Bonjour à tous. Merci de vous joindre à nous pour cette conférence de presse. Hello, everyone. Thank you for joining us for this press conference. I will send it off to Minister LeBlanc.
So, bon après-midi tout le monde. Good afternoon et bonne année. Happy New Year. Today, I am joined in Ottawa by Dr. Tam, Dr. Njoo, and Major General Fortin. I want to start by thanking Canadians who stayed home and gave up their usual holiday celebrations. I know the sacrifices Canadians are making. It's so very important now, as it always has been, that we listen to local public health authorities. Wear a mask, get tested if you have symptoms, and maintain a proper social distance. As the Prime Minister said a few moments ago, we can be optimistic. We have 2 approved vaccines to fight COVID-19. In just a few weeks, our government has delivered almost 500,000 doses of these vaccines to provinces and territories, and General Fortin in a few minutes can give more details about the hundreds of thousands of doses on their way over the coming days and weeks. We are on track to vaccinate every Canadian that wants a vaccine by September. But we cannot let our guard down now. Now is clearly not the time to travel. Let me be also very clear. The Canada Recovery Sickness Benefit, it is not intended for travelers who are quarantining after a holiday. On a dit aux Canadiens depuis mars d'éviter tout voyage non essentiel. On continue de marteler ce message sur toutes les tribunes. Je tiens à faire le point aussi sur la prestation de maladie pour la relance économique. Mon message à ceux qui sont allés dans le Sud, comme a dit le Premier ministre il y a quelques moments, est très clair. Vous n'aurez pas droit à cette prestation et vous ne l'aurez pas. Elle n'a pas été prévue pour vous. Le but de cette prestation est simple, de fournir aux travailleurs un congé de maladie payé s'ils n'ont pas de leur employeur. Canadians are resilient. Canadians want us to do this together for each other and for our country. So I would now like to invite Dr. Tam to say a few words.
Bonjour à toutes et à tous. Bonne année 2021. There have been 611,424 cases of COVID-19 in Canada, including 16,074 deaths. Nationally, there are almost 77,500 active cases across the country, and the average case count is at close to 7,500 new cases reported daily over the past week. The number of people experiencing severe illness continues to increase. And over the past 7 days, there were an average of over 4,000 individuals with COVID-19 being treated in Canadian hospitals, including 770 in critical care, and an average of 122 deaths were reported each day. Canada is also monitoring the emergence of COVID-19 virus variants that appear to be associated with an increased risk of spread. To date in Canada, there have been 9 cases of a variant virus first reported in the United Kingdom, and no reports of other variants of concern, including a variant first reported in South Africa. While there is a lot to look forward to as 2021 begins, we must also proceed with a full understanding of the difficult task ahead. 2 weeks ago, Canada had just exceeded 500,000 cases of COVID-19. Now, with the current momentum of the epidemic and continued high rates of infection in many areas of the country, the 5 months it took to reach our first 100,000 cases is now shortened to just over 2 weeks for the latest 100,000 cases of increase. This ever more rapid accumulation of cases will continue until we can make significant progress in interrupting spread, which is why we must all continue our efforts. Our main task this year is to stay the course with public health practices as the rollout of safe and effective COVID-19 vaccines proceeds across Canada and around the world. We have learned a lot about how to limit the spread of COVID-19 over the past year, with ample evidence to show that early, strong, and sustained public health measures are key to controlling the spread of COVID-19. And we know that whatever the combination of measures and restrictions, there is one vital factor underlying their success, and that is us. When it comes to stopping the spread of this virus, public health measures are only as effective as our collective efforts and resolve to see things through. The behavior and choices made by each and every one of us matter a great deal. As our access to safe and effective vaccine expands, let's resolve to continue supporting each other. 2020 was an unbelievably difficult year, but Canadians have made remarkable achievements all along the way, as individuals, as a country, and as part of the world united against COVID-19. To be sure, there will be challenges ahead, but we have shown that we have the strength and resilience to continue through this next chapter and see things through for a more hopeful 2021. Let's not forget the things that we've experienced, learned, and rediscovered that will be important to hold on to as we go forwards. Among them, the memories of those we've lost and a renewed understanding that none of us can have health unless all of us are cared for and supported. Thank you.
Merci. Bonjour à tous et à toutes et bonne année. Il y a eu 611 424 cas de COVID-19 au Canada, dont 16 074 décès. À l'échelle nationale, il y a presque 77 500 cas actifs et près de 7 500 nouveaux cas ont été signalés en moyenne chaque jour au cours de la semaine dernière. Le nombre de personnes gravement malades continue d'augmenter. Au cours des 7 derniers jours, en moyenne, plus de 4 000 personnes atteintes de la COVID-19 ont été traitées dans les hôpitaux canadiens, dont plus de 770 se trouvaient aux soins intensifs. De plus, 122 décès ont été signalés en moyenne chaque jour. Le Canada surveille également l'émergence des variants du virus de la COVID-19 qui semblent associés à un risque de propagation accrue. À ce jour, au Canada, on a signalé 9 cas du variant du virus apparus initialement au Royaume-Uni et aucun signalement d'autres variants préoccupants, y compris une variante signalée pour la première fois en Afrique du Sud. Bien que nous ayons de grandes attentes en ce début d'année 2021, nous devons être également conscients de la difficulté de la tâche qui nous attend. Il y a 2 semaines, le Canada a dépassé la barre des 500 000 cas de COVID-19. Avec le rythme de propagation actuel de l'épidémie et les taux d'infection qui demeurent élevés dans de nombreuses régions du pays, nous constatons que nos 100 000 premiers cas sont survenus dans une période de 5 mois, tandis que nos 100 000 derniers cas sont survenus dans une période d'à peine un peu plus de 2 semaines. Cette accumulation de cas de plus en plus rapide se poursuivra tant que nous n'aurons pas réalisé des progrès notables pour stopper la propagation, et c'est pourquoi nous devons poursuivre nos efforts collectifs. Le principal défi qui nous attend cette année est de garder le cap sur le maintien de bonnes pratiques de santé publique, alors que des déploiements de vaccins sûrs et efficaces contre le COVID-19 se poursuivent au Canada et partout dans le monde. Nous avons beaucoup appris sur la façon de limiter la propagation de la COVID-19 au cours de la dernière année, et il ne fait aucun doute que des mesures de santé publique rapides, rigoureuses et soutenues sont essentielles pour contrôler la propagation de la COVID-19. Et nous savons que, quelle que soit la combinaison des mesures de restrictions mises en place, leur succès repose sur un facteur essentiel, nous-mêmes. Pour freiner la propagation de ce virus, les mesures de santé publique ne sont efficaces que dans la mesure où nous unissons nos efforts pour venir à bout du problème. Le comportement et les choix de chacun de nous sont très importants. À mesure que nous accédons à des vaccins sûrs et efficaces, prenons ensemble la résolution de continuer à nous soutenir mutuellement. L'année 2020 a été incroyablement difficile, mais les Canadiens ont accompli des choses remarquables dans leur cheminement, à la fois comme personne, comme pays et comme partie d'un monde uni contre la COVID-19. Évidemment, il y aura encore des difficultés à surmonter, mais nous avons démontré que nous possédons la force et la résilience nécessaires pour relever le défi que nous attend et faire de l'année 2021 une année plus encourageante. N'oublions pas les choses que nous avons vécues, apprises et redécouvertes et auxquelles nous devrons nous accrocher à mesure que nous progressons. Parmi celles-ci, il y a la mémoire des êtres chers que nous avons perdus et une conscience accrue qu'aucun de nous ne peut rester en santé si nous n'avons pas tous quelqu'un pour s'occuper de nous et nous soutenir. Merci.
Merci, Dr. Njoo. Et à vous, le général Fortin.
Merci, Monsieur le ministre. Bonjour et bonne et heureuse année à tous et à toutes. I'm happy to start the new year by saying that the deliveries of both December allocations of both Pfizer, BioNTech, and Moderna are now complete. A total of 424,050 doses of vaccines were delivered across the country. Out of those doses, 20,400 of the Moderna vaccine have been delivered to the territories and represent the first very much needed doses for Canada's northern communities. Canada has proven that we're ready for a sustained tempo of vaccine deliveries expected throughout the month of January. This week's shipment of 124,800 Pfizer-BioNTech vaccines is on the way. We expect a further 208,000 doses per week for the rest of this month. We're also expecting 171,000 doses of Moderna the week of January 11. We are working diligently with manufacturers and federal, provincial, territorial, and Indigenous partners to ensure a continuous and predictable flow of vaccines. We're on track to have over 1.2 million doses of Pfizer, BioNTech, and Moderna delivered by end of January. To facilitate this distribution of this growing number of doses in remote and isolated communities in the coming weeks, we continue to acquire and deliver enabling equipment and supplies to enhance the cold chain capacity and flexibility across the nation and to enable onward distribution to more sites across the country. I want to reaffirm to all Canadians that while quantities seem limited, we are scaling up. This is a deliberate operation. We are closely coordinating with provincial and territorial partners, stakeholders, and different other partners every day to ensure that the delivery process of COVID-19 vaccines continues to operate smoothly and in a safe and efficient manner to all Canadians. Alors, je suis heureux de commencer une nouvelle année en annonçant que les livraisons du vaccin Pfizer, BioNTech et Moderna de décembre sont maintenant complétées. Au total, c'est 424 050 doses de vaccins qui ont été livrées aux provinces et aux territoires. Parmi ces doses, 20 400 du vaccin Moderna ont été livrées aux territoires et représentent les premières doses indispensables aux communautés du nord du Canada. Le Canada a prouvé qu'il était prêt pour le rythme soutenu de livraison de vaccins prévu pour janvier. La livraison de 124 800 vaccins de Pfizer-BioNTech de cette semaine sont maintenant en route. Nous prévoyons 208 000 doses supplémentaires par semaine pour les 3 prochaines semaines. Pour le vaccin de Moderna, nous attendons également 171 000 doses dans la semaine du 11 janvier. Nous travaillons de près avec les fabricants et les partenaires fédéraux, provinciaux, territoriaux et autochtones pour assurer un flux continu et prévisible de vaccins. Nous sommes donc sur la bonne voie pour recevoir plus de 1,2 million de doses de Pfizer, BioNTech et de Moderna d'ici la fin de janvier. Pour faciliter la distribution de ce nombre croissant de doses dans les communautés éloignées et isolées au cours des prochaines semaines, nous continuons de procurer et livrer des équipements et des fournitures requis, ce qui améliorera la capacité et la flexibilité de la chaîne du froid à travers le pays et permettra la distribution de vaccins à plus de sites. Je tiens à rappeler à tous les Canadiens que même si les quantités semblent encore limitées, nous augmentons le rythme de livraison. C'est une opération délibérée. Nous travaillons de concert avec les provinces, les territoires et nos partenaires chaque jour pour garantir que le processus de livraison des vaccins contre la COVID-19 continue sans problème, de manière sécuritaire et efficace tout au long de l'année 2021. Je vous remercie.
Merci beaucoup, Général Fortin. Alors, nous prenons maintenant les questions. À vous, Corinne.
Bonjour, merci à tous. Nous allons commencer avec les questions au téléphone pour 3 questions avec une question de suivi chacun, puis nous reviendrons dans la salle. We will start on the phones for 3 questions, 1 follow-up question each, and then we will come back to the room. Operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Sharon Kirky from National Post. Please go ahead, à vous la parole.
Hi, Dr. Tam. Thanks for taking my question. You said there are now 9 confirmed cases of the UK variant in Canada, but I'm wondering how closely are we looking for it? Are we testing just a small sample from people who've been to the UK, or are we doing random sampling?
Thank you for the question. So Canada has been doing genomic sequencing of viruses throughout the pandemic period, and we've been sequencing as a background rate as about 5% of the cases to date, but accelerating that to the background sort of analysis, if you like. At the same time, of course, we've been broadly going out to the provinces and territories, clinical networks, laboratories, to take into account travel-related cases, but also other areas, I think, of target, whether they be specific patient groups, such as the immunocompromised. Of course, as vaccines are rolling out, we want to know if any cases are occurring in persons who got the vaccine. Those are some of the samples that we need to target as well. But also, I think, as you said, that there's some sort of background surveillance samples that also needs to be analyzed as well. So it's a bit like a sort of 3-pronged approach to the genetic sequencing.
And sorry, my follow-up. This variant overtook the circulating strain within like 3 months in England, and it's now in Canada. My questions are, how quickly could it potentially overtake the circulating strain here? And what is our plan to try and reduce transmission? And, and what this might potentially mean for us in the coming months if this variant does overtake the circulating strain?
Yeah, so to date, the cases that we know of that's been genomically identified have been in travelers or their contacts. Provinces are looking at contact tracing, but as far as we know, we're not expecting that there's large numbers of contacts related to these cases. And partly, of course, is a result of the fact that we have quarantine measures in place, including the 14-day quarantine. But, there's always a risk of a virus that can transmit in all sorts of hidden ways to accelerate in different places. So the public health measures and the core public health measures in reducing contacts to reduce spread remains the same. However, you've really got to double down on your efforts with a more transmissible virus. So, getting increased uptake and observations and compliance with these measures become really important if you're dealing with such a high variant. And as you've seen in the UK, if it does accelerate spread, it means that there will be more public health measures that might be needed. So it would become a sort of difficult situation. I'll just have to add that we actually, the whole world is sort of looking for these variants, but there may be some other countries that don't have the capacity to detect these variants. So again, the broad-based measures of quarantine, and the border measures that we have in place are there for a reason, but the community public health measures are really important if you're going to stop rapid spread.
Merci. Prochaine question.
Thank you. Merci. The next question is from. La prochaine question est de Hélène Bugetti de Le Devoir. Please go ahead. À vous la parole.
Yes, hi. My first question is actually for Dr. Tam. We see that some provinces or some regions of the country are delaying the second dose of the vaccine in order to vaccinate more people. Yet Pfizer has said that they don't really know the efficiency of their vaccine after 3 weeks after the first dose. So I'd like to know, what do you think of that idea of postponing the second dose?
Right. This is a topic of course, active discussion. And we're also going back to the National Advisory Committee on Immunizations to ask for some of their advice, looking at what we do or do not know, as well as the key considerations if people were looking at that interval. All I would like to really strongly emphasize is that Canada is committed to a 2-dose vaccine regimen. And so it's not about not giving 2 doses. And we'll certainly be keeping an eye on all manner of data available. There's some limited data on vaccine effectiveness after that first dose, which we will also sort of analyze separately. But that data looks, while it does look promising, it's just very limited at this time. So the concept is a 2-dose regimen. I do think that it comes down to vaccine management and making adjustments in the face of constrained supplies. So initially, of course, given what the supply situation and the uncertainties in December, people were holding back that sort of second dose. Now, I think as Major General Fortin has indicated, with a bit more certainty in the supply, I think provinces are looking towards not holding back that second dose because they want to more rapidly immunize the population with that first dose. And it may depend on the epidemiologic situation. So the Atlantic provinces may not be in the same situation as maybe Quebec, for instance. So I think the provinces and territories are trying to manage that. But you know, that the commitment is a 2-dose regime.
So you don't disapprove, if I get it correctly. Monsieur Leblanc, j'aurais une question à vous poser concernant la prestation pour la maladie. Donc, est-ce que vous pourriez nous dire exactement comment vous allez faire pour colmater la brèche et de manière générale, puisqu'il s'agit de punir les contrevenants, faudrait-il aussi refuser la prestation aux gens qui devront se mettre en quarantaine parce qu'ils ont fréquenté quelqu'un de contaminé ou été contaminés eux-mêmes à la suite d'un party illégal pendant le temps des fêtes?
Écoutez, je pense que le premier ministre a été très clair. Nous allons empêcher ceux et celles qui ont pris des vacances ou qui sont allés sur des voyages non essentiels d'avoir accès à cette prestation de maladie. Ça n'a jamais été dans le but de récompenser quelqu'un qui a manqué de jugement et qui a décidé de ne pas respecter les consignes très claires et d'empêcher ou de ne pas voyager, surtout sur des voyages non essentiels. Alors, le premier ministre a été très clair et on aura au cours des prochains jours les détails précis de comment nous allons empêcher l'accès à cette prestation-là. Mais c'est très clair, ça n'a jamais été pour but d'appliquer à ces gens-là et nous allons nous assurer que ces gens-là ne peuvent pas avoir accès à cette prestation-là. C'est aussi simple que ça. Mais il faut aussi se rappeler l'objectif important qui était beaucoup appuyé par les autorités de santé publique et les autorités provinciales aussi, c'était de s'assurer que les gens qui sont obligés d'aller en quarantaine, comme vous avez dit, parce qu'un partenaire ou quelqu'un chez eux soit est atteint de la COVID ou est en isolement préventif, si ces gens-là n'ont pas de recours à des prestations de maladie de leur employeur. Est-ce que c'est des travailleurs autonomes? Est-ce que c'est des gens qui travaillent à temps partiel puis n'ont peut-être pas accès à des bénéfices de prestations de maladie? C'était précisément pour s'assurer que ces gens-là peuvent faire la bonne chose, demeurer à la maison, respecter les consignes de santé publique et ne pas avoir la pression économique d'aller travailler s'ils ont des symptômes ou si ça va contre les consignes des autorités sanitaires. Alors, nous allons s'assurer que ce mesure importante de protection de la santé publique demeure, mais évidemment que ce ne soit pas abusé par des gens qui ont décidé d'aller en vacances au sud. Ça fait aucun bon sens que ces gens-là allaient avoir accès à ce bénéfice-là et ils ne l'auront pas.
Merci. Prochaine question.
Thank you. Merci. The next question is from. La prochaine question est de Catherine Lévesque de la Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous, bonne année. Monsieur Leblanc, j'aimerais poursuivre dans la même lignée. Vous n'avez pas tout à fait répondu à la question de ma collègue. Comment est-ce que vous allez vous y prendre pour vous assurer que les voyageurs n'aient pas droit à cette prestation? Est-ce que ce serait par voie réglementaire? Est-ce que vous allez devoir déposer un nouveau projet de loi? Puis est-ce que ça va devoir se faire au retour du Parlement ou vous pouvez agir dès maintenant?
Je pense que le premier ministre a été très clair. Nous allons empêcher accès à ce bénéfice-là pour ceux et celles qui ont voyagé. C'était un projet de loi qui a été adopté à l'unanimité à la Chambre des communes en septembre. Alors, tous les partis d'opposition à l'unanimité ont appuyé cette mesure-là pour les buts parfaitement appropriés de donner un bénéfice, un congé de maladie à ceux et celles qui sont obligés pour les raisons de santé publique, les raisons sanitaires, de s'isoler, d'être en quarantaine. Ça n'a jamais été évidemment dans l'esprit de personne pour donner accès à des gens qui ont décidé d'aller en vacances à l'extérieur du Canada. Et dans les prochains jours, nous aurons les détails de la façon que nous allons s'assurer que ce ne soit pas accessible. Mais je peux assurer tout le monde, comme le premier ministre a bien fait, nous avons un plan très détaillé qui va empêcher les gens d'avoir accès à ce bénéfice-là. Et c'est très clair que ce sera en place au premier moment.
OK. Si vous pouviez préciser le premier moment, ce serait apprécié. Et ma question de suivi, c'est sur, en fait, les vaccins. Je voulais savoir qu'est-ce que vous allez proposer lors de votre rencontre de jeudi aux provinces pour les aider à vacciner la population plus rapidement. Quelles sont les options?
Bien encore là, le premier ministre a confirmé que nous aurons jeudi en fin d'après-midi cette semaine une rencontre avec tous les premiers ministres des provinces et des territoires. Et nous allons discuter précisément la question des vaccins, comment les provinces peuvent augmenter le nombre de vaccins quotidiennement, comment, comme le général Fortin vient d'exprimer, comment les centaines de mille doses additionnelles qui vont arriver cette semaine, la semaine prochaine, la semaine d'après, le mois de janvier, on va voir énormément plus de vaccins arriver au Canada et que nous allons acheminer vers les provinces comme prévu. Alors, ce sera une discussion afin de comprendre est-ce que le gouvernement fédéral peut mieux appuyer les provinces pour qu'ils soient en mesure de vacciner leur population plus vite. Le général Fortin, je pense, a bien expliqué aussi, nous avons aussi acheminé, envoyé vers les provinces toutes sortes d'équipements nécessaires afin d'augmenter le nombre de sites de vaccination possibles dans chaque province. Moi, j'ai pris connaissance des médecins de famille, par exemple, à travers le pays, ont offert aux autorités provinciales de participer aussi à une campagne plus vaste de vaccination. Alors, je ne peux pas imaginer que les ministres de la Santé des provinces ne sont pas activement à la recherche d'autres façons pour augmenter la vitesse qu'on peut donner les vaccins. Et évidemment, comme toujours, comme depuis le début, si le gouvernement fédéral peut les appuyer nous serons évidemment là pour le faire.
Merci. Nous allons revenir dans la salle pour 3 questions. We are coming back to the room for 3 questions.
Hi, Tonda McCharles with the Toronto Star. Minister LeBlanc, could you speak to, as I understand it, the negative COVID test requirement applies only to airline travelers returning. And I wonder if or how or will you apply the same requirement on land border crossers? And would, for example, essential travelers, which I guess they still cross the border, are they exempt from that requirement? I imagine there aren't a lot of land border crossers that aren't deemed essential. However, there are some who have been given exemptions in the past. So is the requirement applying to them, and how will it work for essential workers?
Well, thank you, Tonda, for the question. And you're absolutely right. My colleague Mark Garneau announced that at 12:01 a.m. On January 7th, there will be a requirement for airline passengers arriving in Canada to have a negative COVID test in place 72 hours before the departure. We have been working with airlines and other authorities to ensure that those measures are in place. It's an important additional protection for Canadians. It's something that other countries have had in place as well. It in no means is designed to replace the very important quarantine measures, the 14-day strict quarantine measures for international travelers. Dr. Tam and others have spoken about how that is the best practice in terms of reducing or eliminating the chance of an onward transmission for somebody who may arrive in Canada and have COVID-19. We have said that the 72-hour pre-arrival testing requirement will start with airline passengers. And as we said, it comes into effect this week. We haven't decided yet in terms of land or border crossings, land crossings. As you noted, the vast majority of people arriving at land borders are essential travelers, truck drivers, others fulfilling important essential activities for the Canadian economy, and including for the health and safety of Canadians. But we're open to looking always at additional measures that would provide additional layers of protection. But we're starting aggressively and deliberately with international air travelers who arrive in Canada. But we'll continue to work with health authorities and others if they have suggestions about ways that we could further enhance those measures, including perhaps at some point the question of land borders.
Dr. Tam, I don't know if you want to add anything to that. If you do, please do so. I'll just outline my second question, and if you want to weigh in on that point, thank you. Major Fortin, I just want to understand, so the concern that a lot of people have been expressing, including the Prime Minister, around the slow vaccine rollout in many provinces is not just that it's not getting into people's arms, but perhaps it might act as a deterrent in our efforts to get swifter and more volume from vaccine companies if they see they're stuck in freezers. So have you got that? Do you share that concern? Have you heard anything about that? Have any companies expressed sort of a hesitation that Canada can't manage the volume it's got, so why would we send them any more?
Well, thank you, Tonda. So I have not heard any such comment from manufacturers at this stage. What I would say is this. Provinces and territories are scaling up their capacity to immunize. I think it's very important to know that as you get more reliable data on the transportability of vaccines, that helps transport or onward movement for the last mile to the point where people will where vaccine will be administered. That will make it easier for provinces and territories. Secondly, as you get more predictability on shipments, you can align the health workforce. You can align certain locations to be ready to receive, and so on and so forth. So now that we're in a better position to predict with confidence what we're going to receive in January, and in the coming days we'll be able to I guess confirm what we're receiving in the first weeks of February, and so on and so forth. that will help align all those resources. Furthermore, we will be over the next few weeks, we'll continue to ship cold chain enabling equipment that will further bolster the capacity in the provinces and territories and provide them an ability to create additional vaccine distribution sites. So all of that put together really will facilitate the different jurisdictions to administer vaccines effectively and as safely as possible. Oh, freezers, the thermal shippers, the Credo cubes of different types, the countertop, the standing freezers, the dual temp, the single temp. I have a long list, but let me assure you that we're tracking that very closely with the different manufacturers and the providers of those equipment. Some has been, quite a bit of equipment has been distributed already to provinces and territories, and more to come in the coming weeks.
Hi there, Mackenzie Gray with CTV News. Dr. Tam, there's reports out of the UK that 1 in every 50 citizens there has the new variant of COVID-19. How important do you think it will be for Canada to extend border restrictions to keep that from coming out? And in a similar vein for Minister LeBlanc, today the Prime Minister urged Canadians to not travel internationally. But like many things the federal government has urged Canadians to do during the pandemic, many people are not listening, including a number of politicians. This is something that is solely in the federal government's jurisdiction. Why is the federal government, if you believe so strongly that Canadians should not travel internationally, why are there not stricter regulations in place to make sure that Canadians cannot do so at this point in time?
Well, so perhaps I'll start with the second part of that question, and then Dr. Tam or others in Ottawa may want to add. We've said consistently that it was unrecommended. Public health authorities nationally and provincially have, since the beginning of the pandemic, advised against foreign travel, non-essential foreign travel. It is a global pandemic, which means if you decide to go on holidays in the Caribbean or in Mexico or somewhere else, you're not actually escaping the pandemic. You're acting in a way that's irresponsible and doesn't follow the best public health advice that has been available publicly for many, many months. So our government has added additional measures, for example, the requirement for a negative PCR COVID test before being allowed to board a flight coming back to Canada. That measure, which is coming into effect at 12:01 a.m. On January 7th this week. We're always looking at other measures that would better protect Canadians. We've said from the beginning of the pandemic that we are constantly reviewing the measures that are in place to see if we can add additional layers of protection. There is a misnomer circulating that somehow the government of Canada can legislate against travel outside the country. If you look around the world at countries that have requirements for exit visas, I'm not sure we want to be on the list of those countries. But any measure that tells Canadians that non-essential travel internationally should not be undertaken is something that we're prepared to look at. We can't be more clear. And I think Canadians themselves, we've seen expressed over the last number of days, particularly, some of the most compelling testimony came from frontline healthcare workers who are carrying an enormous responsibility across the country to protect all of us. And they have seen, and they are expressing very clearly, a totally understandable frustration at Canadians that might disregard the public health advice and undertake non-essential foreign travel. So we totally understand that very, very reasonable frustration of Canadians. And we're going to continue to take every measure necessary to ensure that that practice doesn't continue.
So I'll just add to that response by saying that I think right now, and the next months are going to be really difficult in Canada. So, reducing any risks of importation and escalation of the pandemic in Canada is really important. As you've seen, mutations of the virus can occur all the time, and these variants of concern that have mutations where we are worried whether it's increased transmissibility or other features, can actually come up in different areas of the world, not just the UK. So these broad recommendations of avoiding non-essential travel is really critical. I mean, Canadians, everyone needs to observe that. And when they come back, of course, the quarantine measures needs to be respected. We're going to do as much as we can to beef up looking at our enforcement measures, if you like. The travelers from the UK, as well as those from South Africa, for now will still be picked out of the lineup, if you like, as they enter Canada with questions on those pick machines. And they will be given additional scrutiny by the public, our quarantine officers. They will require soon, of course, the pre-departure testing to be put in place. But we will be looking at them from the perspective of additional quarantine oversight. But this can pop up anywhere, which is why it's really important to maintain these broad measures and not just one country at a time. The other thing just to add is that if you're in the UK, they're now in their highest level of lockdown. So their advice is that no one goes out of that country for anything but essential and sanctioned travel as well.
One of the things that we heard from provinces in terms of why they're not able to roll the vaccine out quick enough is that potentially they don't have enough staff. We've heard from retired nurses and other former health professionals saying, hey, I can help, put me in. Is that something that you expect that will happen later in the pandemic? And Minister LeBlanc, also on the vaccine rollout, you said yesterday that we expect it to be efficient. Clearly right now, the rollout has not been efficient. Outside of procuring more vaccines, what specifically will the federal government do to make sure the provinces can get the vaccines out quicker than they've done right now?
So you asked 2 or 3 questions in the same question. I'll answer the second part of your question, then Dr. Tam can also add something. The Prime Minister has said that we have convened a meeting of First Ministers, all the premiers, on Thursday late afternoon, a couple of days from now. One of the items we want to discuss with them is the issue of vaccine rollout. Major General Fortin and his colleagues at the Public Health Agency have done an extraordinary job in terms of the logistics of delivering hundreds of thousands of vaccines in record time and with extraordinary care to provincial sites determined by the provinces and territories. And they're going to continue to do so. As General Fortin indicated, we're also providing a whole series of supplies necessary for the safe vaccination of Canadians and supplies necessary to properly hold vaccines while they're rolled out in provinces and territories. So the Government of Canada has done, I think, a very, very good job of helping provinces prepare for the vaccines, not to mention, obviously, the fact that we've procured and paid for these millions of vaccines that will, as the General said, be ramping up very significantly over the coming weeks. So the conversation on Thursday night with First Ministers will be, how can we work together to ensure that there is no unnecessary lag time in those vaccines once they're delivered to provinces and territories at sites that the provinces and territories have determined, that those vaccines are promptly distributed to the appropriate population. So the Government of Canada stands ready, as we have from the very beginning, to do whatever we can to assist provinces and territories. But the vaccination of their populations is properly a provincial responsibility, and our job is to do everything we can to support them in discharging that responsibility as expeditiously and safely, obviously, as they can.
Thank you. Sorry.
Actually, don't have much more to add. I'm not sure whether there is an actual human resource issue at the provincial level, because there's, of course, they have a lot of experience in deploying vaccines, including the seasonal influenza vaccine. And we've heard many health professionals coming forward to say, we can help. I think partly is, as Major General Fortin has indicated, that some of the complexity of the cold chain of the initial vaccines needed to be worked out. And as more instructions or guidance from the manufacturers as they are coming out and allowing the further transportation of the vaccines, then more and more people can help. But as you've seen, the provinces are rolling things out a bit differently in terms of how they construct the clinics, et cetera. So we'll certainly be providing support if needed. I know that we have the Canadian Red Cross and others, on tap, as it were, if there's any additional support that's required as well.
Thank you. So we have about 5 minutes left, so we will take one last question in the room.
Hi, Happy New Year, everyone. David Thurton, CBC News. I just wonder if you could tell us what reports have you been receiving, doctors or Major General Fortin, about the wastage of vaccines? And is this wastage that you're seeing, if you are getting any reports, is it out of the ordinary? Or is it more than what you might have expected?
I personally haven't heard of any wastage in vaccines. I'm not sure what the definition is of. Can you be a bit more precise?
Yeah, well, we're seeing reports out of Alberta and Manitoba that there are some doses left in vials, and because of the storage requirements or the strict requirements around these vaccines, that last dose in that vial has not been able to be used because, I don't know, maybe they ran out of people to vaccinate and, for the allotted period of time. And so they've had to basically throw away those last doses in those vials. So we're seeing definitely reports in Manitoba that they've seen some wastage. The Alberta Health Services has also had to respond to some reports as well as that. So I'm just wondering, at the federal level, have you received any reports of vaccine wastage, and is it out of the ordinary?
I don't know of any reports that's been forwarded to us in terms of vaccine wastage. I think just prior to the Christmas period, we've heard that from a regulatory and other, from the manufacturers, that you can, if there's actual enough for another dose from the 5-dose vial, you could use that. There may be other reasons why all the dose is not used. As you said, it could be at the end of the day, there's some scheduling issue that they couldn't schedule a lot of people, at the same time. I don't know anything about that, so I think that would have to go back to the provinces. But yes, there is, in the 5-dose vial, we've been advised that if you can get an absolute full dose out of it, you can use it.
Just as a follow-up, what advice, what recommendations are you giving to the provinces who might be encountering this issue already, or as the vaccine, more vaccines arrive, they might have said, hey, we have enough vaccines for, I don't know, 50 people today, but only 48 show up, and there's 2 doses left in the vial. What is your recommendation to the provinces to maximize and to make sure that every ounce, every drop is being used?
Well, I think we have at the working level a vaccine supply working group that is, and the Canadian Immunization Committee that is sharing all the best practices that people need to do. And that's really in the provincial jurisdiction of rollout and planning of the clinics. But I'm sure there's lots of best practices that people can have. Yes, there may be specific characteristics of these vaccines, which means you can't just sort of put them back in the fridge and then keep using it. But I think those kind of data will increase as we're going along from the manufacturer as well in terms of the flexibility. But I think, vaccine clinic planning, of course, is important. But that's really not sort of in our federal jurisdictions, but we're very happy to facilitate any best practices amongst the jurisdictions.
Bonjour, merci à tous. Thank you, everyone. This puts an end to today's press conference.